Hi. So I am in capacity today to talk about behavioral economics. It's truly an emerging field. By training, I am an applied economist who was trained in prevention, doing really traditional cost-effectiveness analysis. Based on the discussions on the goals of this program, and I'll explain why, I don't think cost-benefit analysis, cost evaluation analysis really is the problem here. So behavioral economics is a different understanding than economics about behaviors. Does it make sense? I also know that our audience is Portuguese speaking, so maybe some stuff will be lost. But so I will talk about, and I will stick with my notes not to spend too much time, because once I start talking, I branch out. But I will talk about behavioral economics key concepts, just to explain what is behavioral economics. Nudging defined, it's an area, again, new area, 10, 15 years that is being applied in health. Example of nudging components through vaccination example, standard economic models and tools that are related to aging and behavior, and just like concluding comments. But before I start, it's a really, really important point to say. Economics is really about people constantly making cost-benefit analysis with an assumption they'll come up with the best solution. They understand all their costs, they understand all their benefits, and then they are, in a long run, they are going to be better off. And here is a question. Why do we still have people who are not doing what is best for them? And why is it that we need to constantly have intervention nudging? Are they rational or irrational? So economics, traditional economics, is dealing with rationality. We have beautiful optimizing models, and they assume, forget about if the costs are estimated incorrectly, assuming all the costs were involved, all the benefits were quantified, still people will not make the right decisions in a long run that benefits them. Why not? Do we throw away economics? There was a huge fight 20 years ago. People were questioning economics and the use of economics, right? But you don't need to, because in some ways there has to be augmented. The rationality assumption needs to be augmented by predictable errors in decision making. And economists actually started working more in psychology to make sure we are going to include it in traditional economics, and that became behavioral economics. So what I'm going to start with will be behavioral economics. I have not done studies in them. I have done tens of studies more in cost effectiveness, cost benefit, and some of them could not be published because Ontario government, I was working for them, they wouldn't let you publish until of elaborate legal hustle going through. But most of the times when you are doing cost effectiveness, cost benefit analysis, it is not about nudging people to do the right thing. It's about programs, it's about systems. Going and implementing programs that will nudge you, or programs that will put your drug on drug list. So I'm just trying to establish economics that I'm going to talk now, and economics that I have done traditionally. So, yeah, but I would love to do this part, because today, like this year, I went to American Economic Association conference, where you hear first what the trend is. And there were actually presentations about this transition. And one of the presentations was, are we all now behavioral economists? Because all economists are trying to include this irrational side of decision making. So, yes.
Brief explanation about nudge.
Yes. Nudge is when you are creating a situation for people to make a choice that is actually good for them without restricting their choices. So you could, listen, you could go ahead, I was thinking about 100% vaccination. You can go ahead and in dictatorship, tell them this is what is good for you, this is what you are going to do. Let's ration people. Let's not let them have big lunches, okay? Like, I come from a country, we didn't have any obese. That's because we didn't have much to go and buy and overeat, okay? So nudging is you let them have options, but you are adding or default, making them an option that is easier for them to to stay online, for their plan to optimize their health, to optimize their financial well-being, it's easier for them to stick with that. And that's, why is it economics? Because it's about choices. Economics is about choices and trade-offs. If we are going to eat healthy, we are giving up the indulgence of enjoying food. But then we are gaining more health. So that's pretty much why it's economics. Because sometimes I ask myself, wow, this is psychology, but it's also economics. Yeah, many of the most significant health risk factors, such as smoking, poor diet, physical activity, excess alcohol consumption, they have been really in the center of attention because they do cause death. Like my mentor, Martin Meltzer, would say, and it's really rude, but he would say, nothing gets attention of policymakers and the government as people fall dying, okay? So the moment you say, this is something that causes death, gets attention. So physical inactivity is contributing to death. So one of the successful policy tools to influence risky health behaviors has been taxation. But for many, many years, since 1960s, they started this taxation tendency. We are in 2020. People are still smoking. Did it work? To a big degree, yes. But to the individual who still is struggling to control some behaviors, especially to the aging who already had the behavior, it has to be from in, right? It's an inside job. So that is where the behavioral economic comes in. And here is the list of predictable irrational tendencies. The rational tendency, we have a rational addiction model, and they prove that in the long run, if people know they are going to lose lots of money on cigarettes, they'll reduce their consumption to the point of stopping. That's rational addiction model. Lots of people hate that, but it had data, it proved it. But here it also says, in many ways, in regular life, there are these errors. And I actually want to ask Dr. Samoas, among these choices, loss aversion, framing effect, present bias, time inconsistency, status quo, social norm, what is the principle that the cow is committing? What is the irrationality that the cow comes, sees a harmless white line, and then jumps over it? I did not understand that. I'm putting you on spot, basically, but none of the above. But it was predictable, so that may be another invention. Rational cow, I want to say, defending cows here. So, social norms, yeah, probably. Well, yeah, a few cows jumped, and then there is the other one. But there is an expectation of danger, or right, like misguided. So yeah, we could add it someplace. Anyway, one of the really key aspects here is understanding the preferences. And in traditional economics, we have proven it. First thing that we would prove is preferences are complete, transitive, independent. I will not bore you what they are, but what they are saying is you can model it mathematically, probabilistically. And so Kahneman and Tversky showed that under real life situations, people do not follow this. They actually start making choices based on how you frame a choice. And what they had noticed doing kind of trade-off option, choose option, they noticed if you are framing something as a loss, people hate losing money. So the same option when it's a loss will get people's attention, and they would try to avoid it by, actually in this experiment, they were trying to play gamble. Like they would gamble in order not to lose. But they wouldn't care about it if they were going to gain the same amount of money, the same people. So this is also prospect theory showing what we are talking about is that it's not just about telling people you'll get like 1 degree better, right? It's the relativity, it's the contrast. Where you are now, where your healthcare intervention will take you, And this is more visual about perceptual systems. And this was an actual experiment by Kahneman and Tversky that showed you have two squares. The middle of the square is a gray color, but it looks like they have different brightness. Anyone who is looking at them thinks they are different. You perceive them differently. And the example here is they aren't different. You perceive them differently because of the background. Okay? So this is also like the loss and gain, that you perceive the same things differently. Here is an example that is showing just that making choices. You have considering healthcare policy change. You have option A, a health insurance plan with no lifetime limit on benefits, and option B, a plan that limits the total lifetime benefits to $1 million but saves you $1,000 a year. Well, you read saves you $1,000 a year. Everybody likes to save. Do you think people chose it? No, only 20% chose that. Okay? Now you go and put it as a loss, the same scenario, the same plan. Now you are telling them a plan with no limit on lifetime benefits but costs $1,000 more per year compared to option B. You compare it to option B, which is the same option as above, but now they are framing as a loss if you chose A. And now you have 44.2% choosing option A instead of 79.5%. So people are sensitive to framing. What is the application to elderly? What is the application to elderly here? It's an application that it's a very new area, very exciting area. People haven't done studies in that. And you can use the theory that Dr. Simons was saying. You need the theory to apply. You can't find a better theory than this theory to say loss aversion. Let's do interventions based on loss aversion. NIH would love it. So they're like, oh, yeah, okay, we are using here Nobel Prize winning economists, you know. So this is another graphical way. I won't get into too much detail, but just saying graphically, we are used to looking at gains. They are diminishing as you are gaining, so you would care less about an extra $1,000 if you are a millionaire than if you had $10. But then you would actually care more about, as a millionaire, losing $1,000. And it shows on the negative side in the losses. And I don't have the red thing, and I will just move on. But basically, this is showing the same thing, that those of you who are mathematically inclined, the top line is the diminishing return line. And the bottom line that isn't really, it doesn't show very much in economics because it hasn't been studied. And there's the loss aversion. Okay, these are the lessons for designing behavioral economics interventions. And these are from a 2020 paper that shows that it still helps to know when I'm designing a behavioral study, these are components that I can include. And here is in a really poor visibility is showing you start with the goal. You have an individual, and with the individual you set the goal of accomplishing increased maybe walking. These are like for arthritis example. It's not a real study that is done, but it's saying that you can choose all the parts that we can, principles, present bias. It says focus on early benefits. If you have an intervention that explains people early enough, what is it that you are gaining little by little, rather than saying your goal in a year will be you will get healthy or you will have less arthritis. They may not be that motivated, but if you say in maybe 3 days, in a week, your pain will subside, you will not be in so much pain, they will stick with it. And why? Because there is ego. It increases the person's self-efficacy by getting started with a program. So the hardest thing to do for elderly, and I know that because of my mom, is to start a program, physical activity, because they don't believe it's going to help them, because they think I'm so far away. And it shows that it does help. And the way it does help is little by little they feel better. You know, I did stretching twice today, and tomorrow I'm doing more. I can go further. You know, things like that will really help. And so all this salience and priming that basically you provide relevance of the intervention in doctors' offices. One of the most important things here is basically providing feedback, but providing the feedback with an authority, who is the authority person. So I already went very quickly what is nudging, and its advantages of nudging is really, it's very cost effective. What does that mean? It costs very little and it's effective. So when something costs very little and has outcome, most of the times you don't need to prove it's cost effective. It's obvious, unless you are comparing it to another program that is even more cost effective. But generally, in nudging, once you establish through an intervention program that this nudging program was working, these are really scalable things. For example, one of the nudging examples that is in a book, Nudging, that became very famous in 2008, was for children. For school programs, they would put healthy choices up front, and the kids would come and they would choose more healthy foods. That didn't cost anything to the cafeteria. But it really became, they did the study, it was effective. More children were healthy. So that's very much, or sending reminders. It hasn't proven to be so beneficial, but these are basically ladders of nudging. You can have nudging starting from just observing to the point that you are making their choice stems, your default making the choice for them. And some people think, well, that's not fair because you are making a choice for them. But default is always there is a choice. For example, I always bring the organ transplant, but if you have cards that say, I am an organ transplant and it's the default, if you don't want to be an organ transplant, you should tell them, I don't want to be an organ transplant. People think, well, you are still making a decision for them. And the other choice is, well, if predominantly people do not want to be organ transplant, that you leave, I'm not an organ transplant, I want to be. So that default makes a difference. And if you were to check it, you would see how higher it goes when the default is determined, something that society deems more appropriate or more beneficial. But again, at the end of the day, the US is the country with most trying not to nudge too far, trying not to decide for somebody else. So there was a study about US Medicare beneficiaries. Flu vaccination. Vaccination is really a free decision. People need to buy into the program. They have very low vaccination compared to Brazil. And they send out letters to Medicare beneficiaries. And the letters were different by a sender. One was the US Surgeon General, and the other one was vaccination office director. But they also included, there were 4 types, and the 5th was the control. They included choices about time, predetermined time that they needed to go and get vaccinated, or but none of them really showed location. This was a really big deal study. It was published in Nature, and it was very much paid attention. The effect size, however, is very small. If you look at the effect size, they had from 0.4 to 1.4. And the paper was saying that it was like significant. Well, it was statistically significant. Is this really a significant to change a public health impact? Not so much. And what this prompted is that, these methods aren't really being used completely. They are not being used maybe correctly. And every study that comes up with a disappointing result probably is making the road farther for making this interventions applicable. So if you were, again, in the same country, in the US, if you were to include location, you got the vaccination increased by 4.2%. So scientifically, all these things are true. It's, are you including in your study the correct things, and can you defend them or recognize? Sometimes a negative result is also a recognition of something not working, principle not working. So as I mentioned, the neoclassical economic model thinks of people as rational. So you have that plane, you stick to it, and of course you don't. So in that case, the externalities become the point of departure for the policy, classically. And what is externality? It's a person or group that does not bear all the costs or does not collect all the benefits connected with their actions. So some of the costs or benefits are borne by others or by the society. If I am not exercising, if I'm not eating, and I'm in a risk pool for insurance, which all of us in the US are now anyway, then the premiums will go up because my healthcare costs will go up. But in a paper that I had written in 2010 with a colleague, we did want to say, listen, these studies are flawed. You need to start estimating how much money I am contributing to all the programs, Medicare, all social benefits, and then at the end, I am obese, I die. And by the way, there is a huge body of literature that shows obese people are being discriminated in a way that is not noticeable by getting lower salaries. So, you know, at the end, the healthcare cost that the employer pays is coming out from the employee's pocket, if it can be done, if there is a differentiation. So there are studies done that show externalities is a really strong point for government intervention, for saying, and now we are going to increase the tax. Increasing taxes are never popular. So that's why you say, and here is a way we show. And it was in the 1960s, 1970s, 1990s, Congressional Office actually recruited lots of economists to do that external cost studies. Well, what is the right tax again? The right tax amount should be equal to the external cost amount. Because the whole point is you are not internalizing some of the costs. If you are rational, here is the classical economics. If I'm rational, and somehow I didn't recognize some cost that the society is bearing for me, through the tax, I will take it, I will internalize it, and I will change my behavior. That is the only right thing to do for a government that respects persons' liberty, right? So rather than taking the money and giving to another group, because the other group is a better group of people, they don't smoke. No, that's not the idea. We take your money, and that would prompt you not to stop because not to smoke. You felt the pinch. You internalized the cost. All right, so I'll move fast forward and say, now, scientifically, the Congress knew they needed to recruit economists to come up with the appropriate level of tax. They did it for smoking, couldn't do it for alcohol. Alcohol taxes haven't been increased, mostly because yeah, there are debates, but nobody doubts, nobody, in all scientific literature, external costs of alcohol are huge. But it's not being taxed as much because of political attitudes. However, if you were still going to tax them, you still have the behavioral problem. Even if people felt, oh, I'm paying high taxes, guess what? They will still go ahead and drink and smoke. Some of them, not all of them. Some of them would still do that. Why? Because of those behavioral biases. And that's where really behavioral economics comes in. And that's all I have to say as an economist who wants to be a behavioral economist, like every other economist these days. Questions?
You are ahead of time, yeah.
Oh, I am?
So
okay, good.
We do have time for questions here.
That's the other one. I will have a question.
Yeah.
Hi.
Tap up here, please.
Considering that most of people, I don't know about US, but in Brazil are stopping getting vaccinated because of so many different motives. So do you think that if we include this sort of, if you don't go vaccinate, you have to pay extra taxes or whatever, you can convince people to be vaccinated instead of just say, oh, I'm old anyway, I'm not getting vaccinated.
Yeah. It's actually a very good question. It's pretty much similar, and I'm branching, but I have more time. Similar to people paying penalty, now it's taken away, but at some point for Obamacare, healthy people were being penalized if they didn't get insurance, right? And still they would say, I'm okay, I don't want to because I'm healthy. But if you are vaccinating, there must be maybe a deep-rooted belief of not liking vaccination. So can you decide what's the right amount of the money that people will feel like, okay, I can't afford this, or I don't want to pay that much. So again, it's trade-off, right? It's a cost-benefit analysis. The cost of vaccinating should be as much as the penalty, if you can figure that out. Unless you can do that, then you'll just collect money and say you are not a conscientious person, give it to the conscientious group through other programs. Yes.
I'll make a comment on this.
Yeah.
Because there was a question I was going to ask, but it's a comment on what she asked you. The question about vaccination. How to increase the uptake of vaccine using some of the nudging techniques. I'll tell you how. There's one clinic in Columbia, Missouri. That's our clinic, for our academic health center, and I had my own personal experience as a patient there. That has increased my uptake in my family of vaccination tremendously, as well as all the screening. What do? There's not a single time a patient goes to that clinic, leaves the clinic, and is not asked, almost demanded, you need to make sure that you have a date that you like to return, if it's a physical exam. If it's a follow-up too. So they make sure that you, before you leave the clinic, that you have a date. Make sure that you return to it. Very rarely a patient is going to come out without a date. Even if it's 2 years late, I think I will come back and say, okay, get me what's the best way in the week that you can be reached, that you like to come here. So that's a nudging. It's creating an opportunity for them to say no, in a nice way. The other thing they do is that automatically, nobody's naming this, it's not a person. It's automatically, they go to the data, to the electronic health record, and they send messages to every patient based on their age, gender, location, for their screening. If you are 40 and above, the message will come to you many times until you set up your mammography. The message will come to me for something related to hypertension in my age, if I not have had a physical. So that's another way of nudging. It's like creating options. The only options are the good ones, but also remind you. So in that way, you can increase uptake of vaccination. So vaccination is very high in that clinic for the community that uses the clinic. So that's one possibility. I just wanted to make that comment.
Now your question.
No, well,
It was more of a comment than a question. It was under the disguise of a question. So.
The question is about, there was a big discussion yesterday when she presented this when she talked about taxation. That the tax should be proportional. It's almost like saying the taxation should be proportional to the aggravation. The externality is the aggravation, right? It's what people do that force others to do it together. Okay? So my question to you is that, is there any other way that in your economist mind you could think about taxing? Or is that the right way always? There's no option. You always have to say the tax rate is going to be proportional on the cost of externality, because it's very hard to measure externality.
It's impossible.
Yeah.
Yeah, but I honestly didn't understand the question. You can tax anyone any much you want. Yeah. So taxing, no expert on taxing. Even though I'm an economist, I don't claim I'm everything, although we say everything is economics. You understand? It's like economists say all the questions are economic questions, but that doesn't mean I know the answer to all the questions, including taxes. But if you, as a government, you think that you have the right to decide tax rates, which you do, right? Like, it's, you can put any tax you want, like sugary drinks. How are they deciding? How are they deciding the rate on sugary drinks? I don't know. Uh-huh.
I think you can put it's a boundary, right? So the boundary is how much can people pay. So if you put a $1 million tax, no one's gonna pay. So what do you do?
Well, they'll
so
stop
you make
drinking.
a fool of yourself.
They will stop drinking.
You make a fool of yourself. So there is a higher limit that the possibility that people can pay, and obviously you want to push the minimum as as far, yeah.
But that's an example of non-economic questions. I don't take responsibility for that.
I just wanted not to be lost in the discussion is that the main purpose of the tax is to actually diminish the bad behavior. Okay, so don't forget that's the main purpose of the tax. When the price of cigarette package gets very high, people start smoking. And it happened in California first time. Okay, so that's the main purpose, regardless of the externality. That was my kind of a question, I think. But externality is very important to try to estimate because that will be the ideal scenario for taxation. But if we can achieve changing the behavior through the tax, you've done a lot in public health.
I think tax for cigarettes was a really unique, unjustified thing to do because people were misled. And it's addictive, and people got addicted to cigarettes without understanding it. So it's a little different than these days when people start knowing that smoking is harmful for them, right? But that's the whole point. You want people to stop the behavior so that their health goes up from the point of view of individual rights. That I am not redistributing wealth, I'm doing it for you. But if they don't, then you are redistributing wealth. And who is smoking these days? Who are the ones that are most addicted? The poor people. So then there is a movement towards the taxation that, listen, we are raising the prices and the poor don't buy bread for their children and are smoking. So that's another side.
Great.